So my name's Rob Layfield. I'm academic at the University of Nottingham and also have the privilege of being a trustee and chair of the Paget's Association Research Subcommittee. And I'm going to tell you just a little bit about funding for research by the Paget's Association. So the Paget's Association, then, we have kind of three main priorities. We work to support those living with Paget's disease and those affected by the condition. We work to improve awareness about the condition, both with the medical profession and general population. And where we can, we also work to deliver quality and fund quality research. And the research that we fund focuses on improving diagnosis, monitoring, management, and ultimately improving the lives of those who are directly and indirectly affected by Paget's disease. And I'm going to say a little bit more about our research strategy and some of the impact of our research. So Paget's disease of bone is very common, particularly common in the United Kingdom, and actually, based on the total number of scientific papers published, the UK has made and continues to make major contributions towards Paget's research. So the Paget's Association is the only UK charity that solely focuses on Paget's, and in fact, probably the only charity in the world. And what you see on this slide is evidence that we really, in the UK research community, have already made these major contributions to our understanding of Paget's disease. So what the figure shows is a schematic by colour of total numbers of papers across different regions of the world. And you can see in England and Scotland combined then, almost as much research has been delivered as the USA, and the USA being at least 5 times the size of the UK. So across the UK, lots of different sites promote and deliver quality Paget's disease research. Again, this slide illustrates just some of those sites: University of Edinburgh and Sheffield, London, Aberdeen, Manchester, Nottingham, and Liverpool, but certainly not limited to these sites. And the Paget's Association looks to support research across the UK. Some numbers for us, our research portfolio, and in fact, the biggest number here is Paget's at 50. We've just celebrated our 50th anniversary. And there you see on the right-hand side a picture of Anne Stansfield, who back in 1973 first established the Paget's Association. And we've managed to keep the association running and growing since that time. You can see in the kind of pink bubbles some of the different areas our research focuses on. So we're interested in disease mechanisms and new models for Paget's disease so we can understand those mechanisms. A particular interest in Paget's genetics. There is a strong genetic element in Paget's disease. Epidemiology, how Paget's affects different populations and how it changes, but really importantly, patient experience as well. What does it mean to be living with Paget's, and how can we improve the lives of those who are affected directly and indirectly? And then finally, we have an interest, or we support research into the natural history of Paget's disease. And so we realize that historical forms of Paget's disease can inform about future research. So some of the other numbers to just pick out from here, you can see £9,000 in 2023 was committed to educational funding. And so that's part of our remit to raise awareness about Paget's disease. We work really hard to keep the association going, and even our members and our trustees are major fundraisers. So you see there over £50,000 was raised towards the 50th anniversary funding campaign. And there you see Diana, our research nurse, doing her legendary wing walk somewhere over Yorkshire, I think, so on top of an aeroplane. And at the bottom, you see then that this is expensive work. And so we've committed, or we're currently committing over £300,000 to our research portfolio to try and increase our knowledge of Paget's disease and improve the care and improve the outcome for those who are directly and indirectly affected. So it is expensive work. And actually, we rely on support of the community and of you guys as well to hopefully keep the association going. So just one slide example of some of the research that we do. I said the patient experience is really important. And actually, much of our research and our research strategy is evidence-based. It's driven by various resources such as this clinical guideline that was supported by the Paget's Association a few years ago and developed in association with Paget's disease. This is diagnosis and management of Paget's disease of bone in adults, a clinical guideline. So it really makes recommendations for how there should be uniform diagnosis and clinical management. And one of the main things that came out of our guideline really was the importance of pain in Paget's disease. That's one of the major things that people report as being of significance to them. And so, directed by the clinical guideline, one of our research programs at the moment is a pain in Paget's disease project. So this is something that the association funds and supports at the University of Edinburgh. Pain in Paget's disease involves people living with Paget's disease. It involves a whole number of different partners at different universities and different hospitals in particular across the UK, as indicated on the study centres, top right-hand side. And what the study is about is documenting the prevalence of pain and the experience of patients with pain living with Paget's disease. So it's trying to understand what causes the pain in Paget's disease, and importantly, to try and direct the factors that might allow us to manage that pain better as well. So if you want to learn more about our research, or if you want to find out more about Paget's disease as a condition, or get support if you're living with Paget's or know people living with Paget's, please do visit our new website going live really soon. You can become a member, you can become just access information, whatever you want. You come to us and we will support you. So come to that website, let us support you. And just as a final point, do realise as well that we need your support. So your fundraising, your donations, they're all really valuable in order for us to keep going with what we're doing already and to do better in the future. Thank you.